Labor can seem a little bit scary, a little bit overwhelming, but if you know the breathing and pushing techniques going into labor, you're going to feel more empowered and excited for your upcoming hospital birth. And I've got to tell you that I have seen thousands of patients use these breathing and pushing techniques to help them have a better birth. So I am so excited that you are here today. Now, the first thing that we need to remember about breathing and pushing is that it is all here to help this pelvic floor that's kind of like a big paper plate in the middle of your pelvis just relax, right? You have all these muscles in here that if they are tight, it's going to stop that baby from descending into your birth canal. So when you breathe and relax with your contractions, it really helps the baby to come down, helps you to labor faster and easier. Okay, this first one is going to be a little bit silly. Feel free to tell me in the comments what you think I look like, but it is called horse lips breathing. And the time that you're going to want to use this is in between contractions because it's normal to kind of tense up while you're in pain. But the good news about labor pain is you've got a few minutes in between contractions where the pain is pretty much going to go away. Of course, you're anticipating the next pain, but one of the smartest things you can do is truly relax between contractions. And that's where this horse lip breathing comes from. And if you're a band kid like me, all the trumpet players used to do this as well. Not sure how this is going to work with my microphone, but let's just give it a try. It's just, right? You're just letting those lips flat. Try it with me. And I think at the same time, it's good to just kind of shake everything out. It helps release all the tension from your body. Now, Hillary is a perimenopausal woman, and I am finding that my pelvic floor is really related to my jaw and my lips. And I'm seeing more and more videos associating our jaw facial muscles with our pelvic floor. And so when you do this horse lip breathing, it just kind of helps you to relax. So practicing it, it's not something that comes naturally to a lot of people, unless of course you're a trumpet or a brass player, but practicing it in other times when you're feeling anxious or just like have had, maybe you have one of those tough ligament pains. By the way, if you're like, what the heck's a ligament pain? I'll link a video down below about it. But it just helps you to relax. So I know it feels silly. I know it feels crazy, but honestly, just doing it now, like I felt a lot more relaxed as well. So give it a try at home as well. And here's a pro tip with this. You are going to want to practice all of this breathing on your own. I know a lot of people are looking for a birth class that has hours and hours of breathing preparation with you, but the reality is you really need to learn the basics in your birth class and then transition it to your own life by practicing it with you and your partner so that you get good at it and you're using it at times that are feeling stressful or painful. Hello, ligament pain or Braxton Hicks. You can still use all of these techniques at those same times as well. And all of that practice is really going to help as you go into the labor room. If you're looking for a birth class that teaches breathing techniques and pushing techniques, I'm going to link the one that I recommend down below. Okay, the next one I call the he's and the who's, which sounds like a Dr. Seuss novel, right? It really is. I think it's Lamaze breathing. I think that's who started all of it. And the thing I like most about it is how it helps relax your pelvic floor. If you're like Hillary, again, what's your pelvic floor? It's all of these muscles inside of your pelvis. They lay down here kind of like a bowl. There's also other muscles in your legs that helps to support it on the outside. But helping your pelvic floor relax is a huge win. So I want you to notice your pelvic floor. These are the muscles that you use to stop pee, to stop a fart, to hold all of that in your regular life. So that's what your pelvic floor is, in case you're like, Hillary, I don't even know what that is. I get you. I don't think I thought anything about my pelvic floor before I had my first baby. So I see you. And this breathing, you're going to breathe in on the he's and then breathe out on the who's. And you can decide the ratio that you want. So I'm going to do 3 he's to 1 who. Now, most often you're going to use this breathing during a contraction. So you can imagine that you're having pain in your belly and your back and I think the big key to this breathing is that final relaxing breath that really lets everything out. I almost feel like it's impossible for me to tense up my pelvic floor during that final who. You can always do 3 he's to 2 who's. Right? And I want you to, when you're doing it with me, let's do it together. We'll do 3 and 1. That's my favorite. And that pelvic floor just relaxes. The other thing I think is, if your partner's like, okay, let's do 5 to 2 or whatever, it just gives you something else to concentrate on rather than just doing deep breathing during the contractions. I just think it's it's easier for our mind to handle this because it gives us something to kind of latch onto rather than just lots of deep breathing, which can be hard to do. So big fan of the he's and the who's. And again, in that birth class that I mentioned, they talk way more about this. It has a whole natural pain management video that talks more about other techniques you can use. Again, I'll link it down below. Okay, what about pushing? Most of these have gotten you up until your cervix is fully dilated and it's behind the baby's head and you're ready to push. So there are two types of pushing. There's open glottis pushing and there's closed glottis pushing. Traditionally, hospital workers have told people to use the closed glottis pushing. And you can imagine it. It's where you take a deep breath in like you're going to jump in a pool when you were 6. And then you're going to bear down just like you're pooping. Or I've had some people say they've never bared down to poop. And honestly, if you're pregnant and you haven't been constipated at all, huzzah for you. But I know a lot of you probably have experienced constipation, especially my girls out there that are on iron. And so bearing down, you can also, it's like blowing bubbles in a straw. Like if you have a straw and a cup of water, that is similar to bearing down. It's just using those muscles to push down. And ultimately you're filling up your lungs and then using your diaphragm that's below your lungs to push down on baby. That's what we're attempting to do in both of these types of pushing. But with closed glottis pushing, you're going to close your glottis, which normally keeps you from choking. Huge fan of our glottis. Shout out to the glottis. And then just bear down. Now, I'm not going to sit here. It's really hard to show a patient what bearing down looks like. I mean, I have pantomimed a lot of deliveries, and that's a tough one to do. And as a nurse, you don't want to be pushing down while you're in the labor and delivery room because what if, you know. So you're just bearing down. So take that big deep breath in, close that glottis. That means no noise, and then bear down. The other type of pushing is open glottis pushing, where that glottis is open and you're going to pull that either way, whatever you're doing, you're going to pull that big deep breath in and then you're just going to kind of moan. Ooh. Now, this is not like screaming, like horror film screaming. When we see patients who are horror film screaming rather than that low, deep, powerful open glottis pushing sound, we redirect them to really, it's a very low sound where you're still pushing that diaphragm on top of the baby, but it's not quite as hard. Now, I know a lot of people love to talk about open glottis pushing and say that it is easier on your pelvic floor, and it is, but a lot of people find that open glottis pushing just isn't enough for them to get the baby to descend into the birth canal well. So I always encourage people to try different kinds. Try open glottis pushing, try closed glottis pushing, and see which you're liking better and see which one the baby descends better with. The reality is, pushing down a baby sometimes is not the nicest thing to our pelvic floor, and it may not love it. However, we have to do it in order to get the baby out. So those are some things to think about as you go into pushing. And pro tip, you can try all these things if you are constipated on the toilet. You can try pushing down with that glottis closed. You can try moaning it out and see if that works for you. These are things that you can try, especially at that moment in time. And yes, I've reiterated it a couple of times, but the most important part is to try practicing these things on your own. It's not just a one and done thing. You've watched Hillary here on the YouTubes show you how to push, and so you're good to go. Try these breathing and pushing techniques on your own, and I think you're going to feel so much more prepared and empowered for your upcoming birth. Pro tip, make sure that your partner is also prepared for these different things. You don't want them laughing at you when you're doing horse lips. You want them to understand why you're doing them. So show them this video. And if you really want to get prepared, be sure that you're taking a birth class that includes them. The one that I recommend is actually for couples. It includes your partner. So I'll put that one down below. Now you might be wondering, Hillary, when am I going to utilize all these different things? I have a whole video about when, where, and how you're going to push. I'm going to link it up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.